You just got your PSA results back, you see the number, and instantly your stomach drops. It's higher than last year. Your mind starts racing, jumping straight to the worst case scenario. And before you know it, you're deep in a Google rabbit hole where every headline makes the fear 10 times worse. Stop right there. Before you spiral, you need to hear this. I'm a urologist, and I see men in this exact moment every single day. And here's the truth that shocks almost everyone. That rising PSA number is very often completely normal. The fear feels real, but it's built on a huge misunderstanding of what PSA actually means. PSA stands for prostate-specific antigen, which is simply a protein your prostate is supposed to make. A small amount naturally leaks into your bloodstream, and that's what the blood test measures. The best way to think about PSA is as your prostate's check engine light. When that light turns on in your car, you don't junk the vehicle on the spot. It might just be a loose gas cap. All it means is that it's time to look under the hood. PSA works the same way. A higher number does not equal cancer. It's a signal, not a diagnosis, a clue that tells us to pay attention. For decades, men were terrified of one magic number, 4.0, and that fear led to enormous anxiety and a lot of unnecessary procedures. Medicine has moved on, and so should the panic. One of the biggest myths still hanging around is the idea that there is one single normal PSA number for all men. That idea makes about as much sense as saying a 25-year-old athlete and an 80-year-old grandfather should have the same heart rate. Your prostate never stops growing as you age. A 40-year-old man has a much smaller prostate than a 70-year-old man, and a bigger prostate, even a completely healthy one, produces more PSA. More prostate cells simply mean more PSA. That's why a number that might be concerning in a younger man can be perfectly normal in an older one. This is where age-adjusted PSA ranges change everything, because instead of comparing you to one outdated cutoff, we compare you to what's normal for your age. When you look at PSA through this lens, the numbers suddenly make sense. In men in their 40s, a PSA up to about 2.5 is considered within the normal range because the prostate is still relatively small. In the 50s, that upper limit rises to around 3.5 as the prostate begins its natural growth spurt. By the 60s, a PSA up to roughly 4.5 can be completely normal, which is exactly where the old 4.0 rule falls apart. A PSA of 4.2 used to trigger instant alarm bells, but today it's often well within the expected range. For men in their 70s and beyond, a PSA up to about 6.5 can be normal. And it's extremely common for older men to have readings of 5 or 6, simply because of a benign enlarged prostate, also known as BPH. These numbers aren't rigid laws, they're guidelines based on averages, but they show why a jump that looks scary on paper may actually be miles inside the safe zone for your age. And cancer isn't even close to the only thing that can raise PSA. In fact, it's often not the cause at all. Benign prostate enlargement is the most common reason PSA rises, period. Inflammation or infection of the prostate, called prostatitis, can send PSA soaring, sometimes dramatically, and then drop right back down after treatment. Even recent ejaculation can temporarily bump your PSA, which is why doctors recommend avoiding sexual activity for a couple of days before testing. Vigorous exercise, especially cycling, urinary tract infections, recent catheter use, scopes, or other urologic procedures can all push the number higher. A prostate biopsy will make PSA skyrocket for weeks, which is completely expected. Even the simple rectal exam in the office can nudge PSA up slightly, which is why the blood draw is done first. Certain medications, including some used for hair loss or prostate symptoms, can artificially lower PSA, meaning the real number is actually higher. On top of that, genetics and race matter. Some men naturally run higher PSA levels, and men of African descent, as well as those with a close family history of prostate cancer, carry different baseline risks. Here's where urologists really focus their attention. Not on a single number, but on the pattern over time. We call this PSA velocity, and it's all about how fast the PSA is changing. A man whose PSA has sat around 3.5 for 5 years straight is usually far less concerning than someone whose PSA jumps from 0.6 to 1.8 in a single year, even though 1.8 sounds low. That rapid rise is a signal that deserves a closer look. We also use something called PSA density, where we divide the PSA number by the actual size of the prostate measured on ultrasound or MRI. A large prostate with a higher PSA can have a very reassuring low density, while a small prostate with a modest PSA can raise more concern. Context is everything. All of this leads to the most important decision of all: what to do next. Most major health organizations recommend that men have a thoughtful conversation about PSA screening between the ages of 55 and 69. If you're at higher risk, such as being a black man or having a father or brother with prostate cancer, that conversation should start earlier, often around 40 or 45. This isn't about blind testing or blind fear. It's about informed decisions made together with your doctor. So let's go back to that moment when you were staring at your lab report, heart pounding because the number was higher than last year. I hope you see it differently now. That number is not a verdict. It's the first clue. A single PSA number diagnoses nothing on its own. The idea of one normal cutoff is outdated. PSA naturally rises with age. age, dozens of everyday factors can push it up, and often the trend over time matters more than the absolute value. The right next step is not panic, it's a smart conversation with your doctor, maybe a repeat test, maybe imaging, maybe just observation. Understanding what PSA actually means takes the fear out of the equation. You're no longer guessing or spiraling, you're informed, confident, and in control. That rising number isn't the end of the story. It's the beginning of a much smarter one.